Many of you know just this last week we lost Rosalind Carter. And as one person who's followed her, she has been really a champion nationally, even when she was First Lady for mental health. She was one of the first people to say that we need to treat mental illness the same as physical illness. And what she meant by that is if you have diabetes or cardiac disease, but if you have a mental illness, you shouldn't be treated any differently. You should be evaluated, and resources and support and insurance coverage should be provided on an equal basis. So it's my honor that to let you know we also have a local champion for behavioral health, Judy Amabile, who is going to be our speaker today. At the top of her website, among all the things that she has passion and interest for, is mental illness and behavioral health. She's our current House representative, and she's running for Senate District 18. And I welcome Judy to come up and talk to us a little bit about mental illness and where we are going. Thank you.
Hi, everybody. That was quite the comparison, and I definitely don't deserve that, but thank you. So yeah, I'm Judy Amabile, and I'm one of the state reps. We have another state rep here today. Junie Joseph is with us, Representative Joseph. And so let me just start by, I wanted to start by just, maybe you guys all know this, but I don't know if everybody knows the difference between mental health and behavioral health. And mental health is about illnesses like anxiety, depression, schizophrenia. And behavioral health is about addiction. And we put them both under this topic or the word behavioral health, and that's supposed to mean both. But I don't like the word behavioral health because it makes it seem like you're just behaving badly and you could just stop behaving badly and then everything would be okay. And that's particularly insidious when it's implied, when it's applied to people who have substance use disorder, because we already want to think that's your fault. And so I just wanted to mention that because I don't know if everybody knows that. And then I wanted to talk a little bit about mental health and about different kinds of mental health, because again, I'm not sure everybody understands that there's, in my world anyway, two categories. So there's high acuity mental illness and there's low acuity mental illness. And using the word low acuity doesn't mean it isn't a serious illness, but low acuity includes things like anxiety, depression, PTSD, and high acuity is things like schizophrenia, schizoaffective disorder, which is schizophrenia and bipolar, bipolar with psychotic episodes, and other illnesses that result in psychosis. And the reason that there's a distinction is because the treatment for these two things is really different. And the attention that we give to these two categories of illnesses is also really different. And I think we do a decent, not a great job, but a decent job treating people who have low acuity mental illness. I think many people who have depression can go to their primary care doctor and get prescribed a medication that is effective. And that's certainly not true for everybody, but it is true for a lot of people who have low acuity mental illness. And for people for whom going to their primary care doesn't work, we have mental health partners who are also here today and have been a great partner for me with the work that I've been trying to do. And they can see a therapist, they can see a psychiatrist, and again, not perfect, but you can get the care that you need. The thing that I have been focused on in my time in the legislature, and the thing that is a little bit different, is I have really been focusing on high acuity mental illness. And just by way of background, the reason that I'm interested in that is because my son, one of my 3 sons, has schizoaffective disorder. So he has schizophrenia with bipolar. He has manic episodes. He has co-occurring substance misuse disorder. And he's been homeless. He's been homeless here on the streets in Boulder. And he's also lived at the homeless shelter, not for long, but for about 3 months. And he's also been criminal justice involved. And I thought, I'm the only one who's in this boat. This is, wow, this is incredibly hard. And the reason that there isn't any help for this is because we must be the only ones. But then I took a class from the National Alliance for Mental Illness, and I came to find out that actually there are thousands of people in our state, tens of thousands of people, who suffer from high acuity mental illness and can't get the care they need. And part of the reason they can't get the care they need is because it's more complicated. Yes, for some people it's medications, but it is also other supports. It's therapy, it's help with a job, it is help with housing, it is help with your behavioral health issue. It is a whole bunch of complicated things. And so what ends up happening to people in Colorado right now, well, let me just say, we have a shortage of facilities, a dramatically bad shortage of facilities that are designed to help people who have high acuity mental illness. So the standard, the bare minimum that you need, according to Mental Health America, is 50 beds per 100,000 people. And that would be the minimum you would need to make sure that people can find a bed in the continuum of care. So a hospital bed, a residential treatment bed, a group home bed, a transitional housing bed, a supportive housing bed, something along the continuum that is right for where you are with your disease. In Colorado, we have less than 10 beds per 100,000 people. So that's one of the places where we start. So what ends up happening is people get sick. And like the first time my kid had a psychotic episode, he was like 18, and we had no idea that he was having a psychotic episode. We did not know. And we also didn't know the difference between a treatment facility and a detox. So we took him up to Centennial Peaks, and we said, I think he's on something. And he probably was, actually, in addition to having a psychotic break. And they took him, and they had him there for a day or two, and they said, well, you know, he's not really detoxing. And so you need to come get him. So we get him, and we have him in the car, and it's Christmas time, and we're like driving home, and he starts shouting at us, and he wants to get out of the car, and we don't want to let him out of the car. And so we just keep driving, and then he's like, I'm getting out of the car, and then he opens the door, and of course we jam on the brakes, and he jumps out of the car and he runs away. And that started us down this whole cycle of short-term hospital stays. So he's been a patient at many of our state private and public mental health hospitals, what they call institutes of mental disorders. And Centennial Peaks, West Pines Behavioral, Highlands Behavioral, and never was able to stay for more than 3 or 4 days because there is no funding available that will pay for somebody to stay for more than 3 or 4 days. But what happens is the hospital gets a call from whoever your insurer is, and they say, yeah, that patient doesn't meet criteria anymore, and we're not going to continue to reimburse for his care. And then they call you and they say, come get him. He's better. He doesn't meet criteria anymore. But he wasn't better. He was never better. And then he ended up out on the street because we couldn't have him living with us. And then he ended up doing crime. And he was accused of a very serious crime, a misdemeanor crime, but a very serious misdemeanor crime. And we had to have lawyers, and because we didn't want him to go to jail, because we felt like if he goes to jail, he'll never leave. He'll die there. And I still think that if he ends up in jail, he will not be able to survive it. But it turns out there are hundreds of people in his situation who have committed relatively minor crimes, and also people who have committed serious crimes who have had this exact same experience. Short-term hospital stay, short-term hospital stay, short-term hospital stay, jail. So we, right now, our jails in Colorado are the single biggest provider of mental health care services. They outpace all of our hospitals, our state hospital, all of it. And that is really a stain on our state, because you don't get care in a jail. You get worse. And I have a young man who's a constituent of mine, and many of you may have heard about him. He had serious mental illness, he still does, and he was out of control. He was in and out of the jail several times. He tried to kill himself multiple times at the Boulder County Jail. And because this is not an adequate place for them, for people like him, he was strapped to a restraint chair for 12 hours and tased while he was strapped to the chair. And then he was put into solitary confinement, and he pulled out both of his eyes, and he's now permanently blind. And since then, he has gotten out of jail. That was the end of his jail stay. And he's back with his family. He's on a medication. He's getting therapy. He's getting treatment. And he's doing fine. And he can tell his story. He showed up to a meet and greet that I had recently. And I said, "Do you mind if I tell your story?" And he said, "That's why I'm here. I'm here to tell my story, because I need people to know that what happened to me wasn't my fault, but was a failure of our system." So the other thing I want to talk about is this intersection of criminal justice and mental health, because that's where really the thing that you all are worried about, public safety, crime, homelessness, that's where these things intersect. And because we're not providing adequate care upstream, we're ending up with a bunch of people who are cycling in and out of our jails. And they don't get better in jail, and then they get released from jail, and then they commit more crimes. And then they go back to jail, or they just get bonded out, or whatever it is that's happening. But we're not taking the time, and we're not providing the care that gets them better. But people can get better. Most people who have schizophrenia or schizoaffective disorder, if they get the care they need, they do get better, and they are able to function. And I don't know what we're waiting for in terms of providing that care. Right now in Colorado, we have this thing called, it's a legal term, competency to proceed. And that's where you end up in jail, but you're not competent to assist with your own defense. So you've been charged with a crime, but you haven't been convicted of a crime. And we right now have 480 or so people in our jails across Colorado who are waiting for a bed at the state hospital so that they can have their competency restored. And some of them, the guy who's been on that list the longest has been there for 450 days. So a year plus waiting to go to the state hospital so that he can be made competent, so that he can go back to jail and stand trial. And this, again, is it's costly, and it's also a miscarriage. And the other thing that happens is people time out. So we can't keep you there indefinitely. So you can be on this competency wait list, and it doesn't matter even if you've committed a very serious crime. You can time out. you can have served as much time as you would have if you'd been convicted, and then they have to let you go. And then we just let people go, and guess what? They reoffend. So these are the issues that I'm really focused on. I am the chair of a committee that focuses on these issues, that works all year round. And I have been participating in all kinds of conversations about this. There are budget requests that we're looking at right now in front of the governor's office to try to address this. But I really would love to enlist all of you, because even though you might think, well, I don't know anybody who's caught up in this thing, it is impacting all of us, and it is costing us all. And we are all participating in something that I think is creating moral injury by walking over bodies in the street, by walking past people who are shouting and delusional and thinking, oh, there's nothing I can do about it. And you're right, you can't do anything about it, but we collectively can. So Cindy gave me the high sign because I want to be able to take questions. And it's embarrassing for me if you guys don't have any questions, so.
Judy, thank you for sharing that. I've got many questions, but let me just boil them down to two. I forget, I need a mic. Thank you for sharing that. I guess my first question is going to be, even if the insurance industry were such that it would, in fact, fund the care that's needed, is there a fundamental problem in that patients would simply say, I'm out of here, I don't want to be here? So, but then beyond that, I guess my bigger question is, what do you see as in the perfect world would be the system that we should have?
Yeah, thank you for that. First off, I'll say that most people with high acuity mental illness, and Cindy, you could correct me if I'm wrong, but I think most people who have the most severe disease are on Medicaid because they're not able to work, they're not able to hold down a full-time job. And so Medicaid is really the place where we need to lean in and say, hey, we collectively with our public Medicaid dollars need to address the problem. And so what do I think is the solution? I think we need more beds in our civil system. So right now we have 90 beds at Fort Logan. That's the public hospital that takes care of people who haven't committed crimes. 90 beds. That's the only place in Colorado where if you haven't committed a crime or been accused of a crime, where you can go and spend more than, a short amount of time. That's the only place where you could stay for 3 months, 6 months, 9 months, a year, if that's what it takes for you to get better. So we need more of that. And then we need more of the next step down, the transitional beds. That's residential treatment beds. And we passed a bill in 2022 that put $65 million into transitional beds, and they're just starting to take patients in these beds. That's 125 beds. I have a group of parents of adults with serious mental illness. I came back to them. I said, good news, group. I got 125 beds. And one of the women in the group said, you should be ashamed of yourself. That is so inadequate. We need 1,000 beds. So 125 is a start. I'm not ashamed of that. I'm happy with that, but she's right. We need probably 500 of these transitional beds, different kinds of transitional beds, to treat different people with different levels of illness. And then we need things like group homes, and then finally supportive housing. And it sounds expensive and it sounds hard, but we are spending the money now on our criminal justice system, on our jail, and on these ineffective short-term hospital stays.
Hi there, thanks for coming to see us today and give us some more information here. So I'm Daryl Brown, I'm with Boulder Community Health. As you know, we're one of the few hospitals that come hell or high water, we've maintained our inpatient beds for mental health. We've actually expanded services, which we're very proud of. My question to you is really, what rather than public funding, what can be done for private payers to drive better coverage for people that actually, they're covered under insurance, but they're covered poorly under their plan because the private payers?
Yeah, so I think that's a piece of the problem, and I think we have to push more on the Division of Insurance, to push more on the insurance companies to do a better job of what we call parity. So we don't have parity between mental health and behavioral health, mental health and physical health. If you're sick and you need to be in a hospital, if you have cancer, if you just got done having hip surgery, and you can't go home because you have nobody at home to take care of you, they don't just say, well, go be homeless then. Tough luck. They send you to a nursing home so that you can get rehab. And so we need that continuum of care, and we also need our private partners to participate in that. But honestly, again, so many of the people who have high acuity illness are on Medicaid, and that's the place. I think Boulder community would be very happy if Medicaid reimbursed at a higher rate. And also, it would be, one of the things I would love to see Boulder community do with your currently empty floor is to have the ability to get reimbursed to not just do crisis stabilization, but to actually do recovery, to be a place in Boulder where somebody could go for 30, 60, 90, 120 days, and you all get paid for that by Medicaid. And we are working on these waivers, and that's one piece of the puzzle, but also we need partnership with organizations like yours, and I know you guys have been amazing.
Hi, Judy. First off, thank you for being here today and talking about your story. I ran the Boulder Mental Health Foundation for some time a while ago, and at that point in time, so many of our patients were in the jail systems, and the jail system cost us a heck of a lot more money than it did to get them out of the jail. Have we gotten any further ahead on that at all? Or do we intend to?
Okay, so I'll say, sadly, no. It's gotten worse. When I started doing this work 3 years ago, we had 300 people on the competency wait list. Today we have 480. So, and that's just one piece of the jail population that's suffering from serious mental illness. That's not all of it. And the last time I talked to our Sheriff Curtis Johnson, he told me at least 60% of the people in the Boulder County Jail have a diagnosed mental illness. And they're overwhelmed by that. That's not what they signed up to do. If you signed up to be in law enforcement, you signed up to be in law enforcement. You didn't sign up to be a mental health care worker. They don't have the training. They don't want to do the work. It's not to say they aren't doing the work, and they're doing as good a job as they can, but that's not where people belong. So are we trying to change it? I am.
Thank you very much. You started out, I think, outlining one of the biggest problems is education, and you were just telling us the difference between behavioral wellness and mental wellness. So you're continuing that. Also, the legislation, you're working hard to improve our legislative capacity or funding for mental illness. There's a group at the Naropa University. The Naropa University is working very hard on research and development and counseling study for psychedelics as a tool to research or to help people with the various mental illness. And one of the things they need support with is through legislation, which Colorado is actually becoming a leader, I think, among the states. But what's your opinion, or where do you stand on helping explore using psychedelics?
Yeah, okay, that's a great question for me. So the ballot measure that we passed last year that legalized psychedelics, I voted against that. I voted against it because it had two pieces to it. One was a regulated place where clinicians could interact with patients and give them these psychedelic medicines and help them recover. And that is good. I support that. But the other piece of this ballot measure was anybody can grow any amount of mushrooms that they want at their home, and they can give them to anybody that they want. And in the ballot measure, it said, if you give these psychedelics to kids, you get a $200 fine. And I thought, this is crazy. This is not going to end well. So we passed the ballot measure, and then I was one of the co-prime sponsors of the bill to enact the ballot measure. And we had to give fidelity to the ballot measure. We had to honor the will of the voters, but we did try to put some guardrails around the unregulated market. And we did say it's actually a crime to give these products to kids. I think they are tremendously promising for people who have PTSD, depression, anxiety. But they are not good. They are actually bad for people who have psychosis. So one of the things that we've been experiencing lately in our family is that people are giving my son, who has schizoaffective disorder, mushrooms. Here, take these. These will be great for you. And they're not good for him because he's already psychotic. And so these psychedelics make that much worse. But that's not to say that it isn't good for some people, and I think we absolutely should be studying that. We should be allowing that to happen in the regulated framework that was laid out in the ballot measure. And I think we should be doing more research on that. There should be double-blind studies so we actually know whether it's effective or not and at what dose. Like a microdosing is very popular. And I said to the proponents of this ballot measure, well, what is a microdose? How much is that? Ugh, I don't know. So maybe you all know at Naropa what is a microdose, but I don't think people who are growing these at home and taking them know what a microdose is. And I also, I asked, well, do you get used to it so that you need more to have it have the same effect? I couldn't find anybody who knew the answer to that. And again, maybe you do. But, what is it we're proposing here, and how are we studying it, and how do we know how effective it is, who it's effective for, and in what settings and what dosages and that. So I think there's tremendous promise with it, and I absolutely support that.
Thank you. We have time for one last question.
Thank you so much for your talk today. I'm just wondering, what is the status of the mental health professionals? Is there a shortage? I know I'm a nurse, and that's a big issue in nursing these days.
Yeah, so there's a massive shortage of mental health professionals along the whole continuum of professionals. And there's not only are there not enough people who are in the field, but also a lot of the people who are trained are not participating. And in Boulder, we have a situation where a lot of our psychiatrists and therapists don't take Medicaid, they don't take insurance, they only take cash. And so that's good for people who can pay, but it's not good for people who can't pay. And so clearly one of the solutions is to pay more. And we've been working on that, and the state has started to bump up reimbursements and pay scales. The state hospital is offering people something like a $10,000 signing bonus in Pueblo to sign on as a nurse because they have a massive shortage of nurses. I think it's starting to get better, but the other piece, so pay is important, but the other piece that really matters is job satisfaction So if you're working at the state hospital in Pueblo and it's just a competency mill, you're just bringing people in from the jail, shooting them up with Haldol, getting them to a place where they can know what the difference is between the judge and the public defender and the DA, and then sending them back to jail to have their case processed, that's not very satisfying. And I think most professionals want to know they helped people, they did good. And so we have to make sure that's part of what we fix when we address the staffing shortages.
Representative Amabile, thank you so much for being with us today. And it's amazing how you've taken a misfortune in your own life and turned it around to help all of us. So thank you for that.
Thank you. Thank you all for being here. I really appreciate you inviting me.
And as for another disease in the world, Rotary International for the last 35 years, has been doing its best to eradicate polio around the world, and we're this close. And in your name, we're donating 100 doses of polio vaccine. Thank you.
Don't miss out on all the fun. Red Badge Breakfast meeting coming up December 7th, Thursday on Club Service, and January 11th, also a Thursday, on Youth Service. They will be held at the Buff in Boulder from 7:15 a.m. to 8:30 a.m. These breakfasts explore various pathways of service within Boulder Rotary, and a great opportunity to learn about the club in a laid-back, small group setting. Hope to see you there.
It's that time of year again when Boulder Rotary has the opportunity to help make holiday wishes come true for some of Boulder's children. Share a Gift provides holiday gifts for over 1,500 children from over 600 low-income families in Boulder County. We're looking for volunteers. It's a ton of fun. And if you can't volunteer, please consider bringing an unwrapped new gift to a BRC meeting today or at our next few meetings in December 8th or December 16th. You can also make a cash donation. Look for Share a Gift elves in the back of the room or find out more in the rib.
What's more fun than going to the National Western Stock Show? Going to the stock show with other Rotarians from throughout the district. Wednesday, January 17th is Rotary Night at the Stock Show in Denver. The event includes an optional special dinner for Rotarians in the Northwest Club for $31. Admissions to the grounds and the rodeo is $15. The sign-up deadline is January 13th. Even if this is not your first rodeo, you'll have a great time.
Boulder Rotary's own World Community Service Committee recently supported a new global grant championed by the Rotary Club of Denver. The project goal was creating student health clubs in Uganda, Kenya. It's a geographic expansion of their highly successful 2021-2022 pilot project that our club also supported. A student health club is a school-based program with the goal to attack the spike in teen pregnancies that occurred throughout Kenya during the COVID lockdowns. The pilot global grant developed student health clubs in 22 secondary schools in the sub-county of Uganda that dealt with many teen-related topics. As a result, the pregnancy rate for our student health club members was only 1.08% compared to 9.02% for those in the sub-county not in the program. The success of this project strongly confirms that student health clubs give girls and boys information about their sexual reproduction and guide them to make wise choices. The success is a compelling reason to expand the program to other Kenyan teens. The new project plans to add another 40 schools to the 22 existing schools and 2,000 more students. It will test our ability to scale up training and inspire more students in more schools. For more information, contact any of the people on the screen.
help young people engage in the world community as change makers and informed citizens. One way is the World Affairs Challenge. It's an international program and competition for middle and high school students to develop and implement their own smart solutions for UN Sustainable Development Goals. Last year, Brenda Parker's 8th grade class at Boulder Macintosh Academy accepted the World Affairs Challenge and competed against several hundred schools around the world. They won in their age group. Their project involved research and a project resetting the polluted ecosystem of a wetland near their school. Next week, those students and their teacher will be here to talk about the project, the competition, and being world citizens.
All together now. Have a great weekend.